Hi everyone, I'm Tammy and I'm the Staff Development Manager for Home Health and Hospice. Today we're going to be going over pleural drains, how to properly drain your patient and perform a complete dressing change. So before we dive into that, I want to make sure that you're familiar with the bottles that we have and can provide to our patients. The first bottle that you see here is our Acept bottle. And this bottle is probably one you're more familiar with as our patients coming out of the Torrance Memorial Hospital. These are the connections and catheters that they usually come home with. These bottles have a green cap and the end connection is different. Note that if you have a patient with this catheter, it's very simple. It's just almost as if you're connecting a IV catheter to a clave, and it simply connects this way. If you have a patient that has the Pleurex catheter connection, note that the end cap is different. The patient would have a different end connection here where you would remove a white cap and insert the catheter in. It would click and you would twist this to lock. The same functionalities of these Pleurex bottles are the same. There is no difference in what they do. The only difference between the two bottles is the end connection. So it's important for you to know the difference between the two, which catheter your patient has so that you can bring out the correct bottle. So let's talk about what's inside the actual pack. You'll be receiving a bottle that you're going to be using to drain your patient, in addition to a set of sterile equipment. Inside the sterile package, you will receive 2 sets of sterile gloves, 3 alcohol wipes, a T-gauze that's made of foam, and this is what sits on the patient's actual insertion site. You'll also note that you have a pack of sterile gauze that sits right on top after you have coiled the patient's catheter underneath. And you have a large tegaderm that you're going to be using to secure the site. Please note that you also have a blue emergency clamp that you're going to want to make sure you keep until the very end. This clamp is used in the case that the patient's catheter has cut or that it's leaking. This is the clamp that we're going to use in the case of an emergency. So hold on to this until after the patient's drainage is completely done and that you have already performed the dressing change before discarding. So let's get started. Before I even begin draining my patient, I want to make sure that I'm checking for a physician order. I know how much I'm draining, I have the right equipment, and that I've checked my patient's vitals. You want to make sure that your patient's vitals are stable, that you've checked their blood pressure, and everything is okay before you begin. So before we even begin draining our patient, we want to make sure that we remove the old dressing. To do that, you want to first hand hygiene and grab a pair of clean gloves. The process of actually removing the patient's old dressing is not a sterile procedure, so you don't need sterile gloves for this process. Go ahead and don your gloves and let's remove the dressing. So we've gotten to the point where we've taken off the dressing. You just want to make sure you're very careful and that you're not pulling on the patient's tube. We can go ahead and remove all of the gauze and just make sure you do an assessment of the patient's insertion area. Take a look and see if there's any drainage, if there's any redness to the site. We're going to go ahead and discard the gloves and discard the old dressing. Now you're at the point where the site is clean and you're ready to drain your patient. So after you have removed the patient's old dressing, you should have already hand hygiened and opened up your sterile kit, because this is the time that we're going to be putting on our sterile gloves and connecting the patient to drain. So your first set of sterile gloves is right at the top. I want to make sure that I don't touch any part of the sterile kit. I put on my sterile gloves. I'll put on my second pair, and now I can maneuver the kit however I need to. So I usually like to make sure that I have everything ready to go. I'll set my second sterile pair of gloves to the side. I'll put all of my dressings in place so that I can easily maneuver and grab them. You'll have 3 sets of the alcohol wipes. I like to make sure I tear mine and have them ready. And I want to make sure that I lift my window so that I can clearly kind of see where I'm going to be placing my tegaderm. Okay, so this is the window that you're going to be opening up so that you can see clearly where you're going to be placing your dressing. And then this is going to be your sticky side. So you just want to make sure everything is ready to go before you actually start touching the patient and become unsterile. So we're going to go ahead and connect the patient to the actual drainage. You want to make sure that you open up your alcohol wipes and you have them ready to go. So now I'm ready to clean my patient. I want to make sure that once I touch my patient's catheter to clean, my left hand is now no longer sterile. And I want to make sure that I clean the hub really, really nice to make sure that it doesn't get infected. I'm not introducing any type of bacteria. So you want to make sure you scrub the hub for at least 20 seconds before you connect the patient to the drainage bottle. So let's go ahead and clean for 20 seconds. Once the 20 seconds is up, you're going to go ahead and now connect the patient to the drainage bottle. The one thing I do want to mention is that before you connect your patient to anything, you want to make sure that the clamps are completely closed, both at the top and the clamp here that you're actually going to be controlling to see how much fluid comes out. You never want to open the clamp all the way. You want to make sure that you drain your patient slowly. So once the patient is connected, you can go ahead and slowly remove the clamp, and this is how you control the amount of fluid that comes out and how fast it comes out. So the clamp is now open. You're going to make sure you watch the patient drain completely. Once the patient is done draining, you can go ahead and remove your second set of gloves after you've disconnected the patient. You'll hand hygiene and put on your second set of gloves. So at this point here, the patient is now done draining. I'm gonna go ahead and I'm gonna make sure that I clamp again before I disconnect my patient. So I make sure I clamp the bottle. I'm gonna disconnect my patient here, and I'm gonna set the bottle to the side, okay? Once I've disconnected my patient, I'm gonna go ahead and remove my gloves before I put on my second set of sterile gloves. So at this point, you are ready to perform the dressing change. Before we even put on the new set of gloves, we're going to hand hygiene first. Put on your second pair of sterile gloves. And now we're ready. So you want to make sure that you start utilizing the alcohol pads that you have left to clean the site and to clean the hub before you put on the new dressing change. So the second set of alcohol wipes, I'm going to go ahead and have them ready. You're going to go ahead and use the first alcohol wipe to clean the actual site. So this is where we want to make sure we clean really good the area. Once I've touched my patient, touched the catheter, I am now dirty. So you want to make sure if there's any gunk here at the insertion site, you're making sure you clean all of that off. And I'm going to discard of this, okay? The other alcohol wipe is for me to use to clean the hub and make sure that there is no extra drainage at the very end. So I'm going to go ahead again, scrub the hub, make sure everything is nice and clean before I put the dressing on. I'm going to discard of that, and now I am ready to get the foam T-gauze. So this foam T-gauze sits right on top of the patient's insertion site. You're going to go ahead and coil the tubing, and this next set of gauze goes right on top. And then lastly, here comes your tegaderm. So it's really easy. Once you have all of the window completely removed, you can see exactly where you're going. So you can just go ahead and remove this tegaderm this way, and it goes right on top of your patient. Once you're all done, this is how the patient's dressing should look like. Don't forget to add your initials, date, and time that the dressing was changed, and you're all set. One last thing I do want to mention, all the contents in this bottle should be discarded into the patient's toilet. Grab a pair of scissors, cut the green valves, and dump the contents into the patient's toilet. This actual container gets put into a trash bag and discarded in the patient's home in their trash bin. At this time, you can go ahead and remove your gloves. Make sure you hand hygiene and clean up the space around you.